Regrettably, many people fail to detect the early signs and symptoms of colon cancer, resulting in a delayed diagnosis and worse results. Hello and welcome to the Middle-Aged Encyclopedia. Colorectal cancer, also known as colon cancer, is a form of the disease that typically strikes those over the age of 50. It develops in the large intestine or rectum. The colon is the large intestine's muscular tube leading to the urethra. When cells in the colon or rectum proliferate and expand out of control, this is called colon cancer. The good news is that colon cancer may usually be successfully treated if caught early enough. Colorectal cancer is diagnosed too late in many cases because people don't recognize the warning signs. Some people with early-stage colon cancer have no symptoms at all, while others have signs that could be mistaken for another ailment. The risk factors and warning signs for colorectal cancer are all covered in this video. We advise you to see a doctor if you encounter any of the signs and symptoms shown in this video. Your prognosis for therapy and recovery will be much brighter if you catch the problem early. So, let's get started and learn more about the signs of colon cancer. Subscriptions and likes enable me to create better videos. First, constipation. Constipation is not a symptom of colon cancer in and of itself, but persistent changes in bowel habits, including constipation, can be. A blockage or obstruction in the colon caused by colon cancer can result in symptoms such as constipation, stomach pain or cramping, and bloating. Second, abdominal pain or cramping. Constant stomach pain or cramping, as well as bloating, gas, or discomfort, might be symptoms of colon cancer. The site of the pain can also be significant. If the pain is on the lower left side of the abdomen, it could indicate that the cancer is in the descending or sigmoid colon. If the pain is on the lower right side of the abdomen, it could be caused by cancer in the ascending colon. Third, weight loss. Losing weight by dieting or limiting food intake is not a big deal, but you should be careful if you lose weight unintentionally. When cancer begins to invade and live in the body, cancer cells take in nutrients from the body to survive. Its purpose is to break down human proteins and fats and use them for their own nutrition. As this structure repeats, the energy in the body decreases steadily during pregnancy. If cancer cells proliferate rapidly, you may lose about 10 kilograms in 2 months. Fourth, rectal bleeding. Because colon cancer usually begins as a small growth or polyp in the lining of the colon or rectum, rectal bleeding can be an indication of the disease. If the cancer spreads, it can bleed into the colon or rectum, and this blood can subsequently exit the body through the rectum, resulting in rectal bleeding. In certain circumstances, the bleeding may be extremely minor and difficult to detect, or it may be intermittent, making it difficult to pinpoint a specific source. But, if the bleeding continues or becomes more frequent, it is critical to seek medical attention because it could indicate a more serious underlying issue, such as colon cancer. Rectal bleeding can be caused by a variety of disorders, including hemorrhoids, anal fissures, and inflammatory bowel disease. As a result, a proper diagnosis by a healthcare professional is critical to determining the underlying cause of rectal bleeding and ruling out potentially catastrophic illnesses such as colon cancer. Fifth, weakness and fatigue. Anemia is a condition in which the body does not have enough red blood cells to supply oxygen to its tissues, and chronic or recurrent bleeding in the colon or rectum can be caused by colon cancer. Weakness, weariness, and difficulty breathing are all symptoms of anemia. Colon cancer can also trigger the release of energy-draining substances like cytokines and other immune system components. So, what are the factors that affect colorectal cancer? Colorectal cancer is caused by various lifestyle variables, but also by genetic factors. The majority of patients with colorectal cancer are over the age of 50, and the American Cancer Society recommends starting screening at age 50. Nonetheless, several variables contribute to certain people developing it at a younger age. These people need to be tested more often than others. A family history of colorectal cancer or precancerous polyps is one such risk factor, particularly in parents, siblings, and children. 1 in 5 patients have colorectal cancer in their family. A family history of bowel disease is another risk factor. Lynch syndrome is a genetic syndrome that includes both polyposis colorectal cancer and non-polyposis colorectal cancer. Colorectal cancer is also caused by specific lifestyle factors, and modifying these behaviors can reduce the risk of developing colorectal cancer. First, smoking. Long-term tobacco users have an increased risk of developing and passing away from colorectal cancer compared to those who do not use cigarettes. While smoking is most commonly associated with lung cancer, it also increases the risk of many other types of malignancy. Second, not being physically active. The risk of acquiring colon cancer increases with inactivity. Exercising regularly, especially at a moderate to strong intensity, can help reduce the danger. Third, alcohol. The risk of developing colorectal cancer increases with alcohol consumption levels. Some danger has been linked to even low to moderate alcohol consumption. Avoiding alcoholic beverages is recommended. Men shouldn't have more than 2 drinks each day, while women shouldn't have more than 1. Possible health benefits include a decreased risk of cancer. Fourth, overweight or obese. An increased risk of colon cancer development and mortality is associated with being overweight or obese, extremely overweight. People, especially men, are more likely to develop colon and rectal cancer if they are overweight. Losing weight and keeping it off may help reduce your risk. The lack of symptoms in some cases of colorectal cancer should not be overlooked. This is why it's so important to get screened regularly for colorectal cancer, especially if you have a higher risk of developing the disease because of your age, family history, or other factors. See a doctor right away if you have any of these symptoms or are worried about your risk for colorectal cancer. While there is no known cure for colorectal cancer, it is possible to lower your risk by adopting a healthy lifestyle, going for frequent screenings, and being aware of the warning signals. Keep in mind that you can greatly improve outcomes and even save lives with prompt diagnosis and treatment. Leave a comment below to let us know if and how much this video has helped you. I'm waiting for you in the next video. Subscribe to our channel for more informative videos like this one. Thank you for watching, and don't forget to take care of your health.